Hi, this is Stacey, and we are going to look at pre-oxygenation for RSI, specifically with these two devices, the non-rebreather mask and the bag valve mask. And we're going to look at the pros and cons of each. Okay, so we're going to start with FiO2 to begin with. Now, the non-rebreather mask to start with, if it's attached to 15 litres per minute, is going to give us a relatively poor FiO2, and that FiO2 is going to drop further if the patient has high demands, if they have a high minute ventilation. So at 15 litres per minute, this device is inadequate for pre-oxygenation. The workaround for that is attaching this to a high flow meter, and we have the 70 litre per minute flow meters in ED now. If we attach the patient to at least 40 litres per minute of flow, and normally we'd set it to 50 litres, then we're going to get a really good FiO2 from this device. And also, if the patient's minute ventilation is high, they're still going to get a good FiO2. The BVM is better with the FiO2 in that it's going to give them a reasonable FiO2 even at 15 litres per minute. Nonetheless, if we increase the flow rate to the BVM to 50 litres per minute, we can increase their FiO2 further. So for both devices, ideally we should be using flush rate oxygen at least 50 litres per minute. So the next point we'll cover is the simplicity of the two devices. The non-rebreather mask is essentially set and forget. Once it's on the patient and it's relatively well fitting, attached to oxygen at flush rate, we can leave it alone. We don't need to worry about it. Our patient's going to be well pre-oxygenated. The BVM, on the other hand, needs somebody to stand here maintaining a seal to deliver a decent FiO2. So we need an extra pair of hands doing this for our entire pre-oxygenation period. If this is the airway practitioner, or the airway practitioner is also the team leader, then they may get distracted from maintaining this seal, and then we can potentially lose some of our pre-oxygenation benefit. So the non-rebreather mask wins from a simplicity point of view. Next, we'll look at which is the more fail-safe of these two devices. Well, the non-rebreather, as we said, is just set and forget. As long as this is well-fitting to the patient's face and it's attached to high-flow oxygen, we can guarantee that the patient's getting a decent FiO2. The BVM, however, needs two things to ensure that we're getting a good FiO2. First, this exhalation port needs to be covered. If this is not covered, then the patient can entrain air through this port and get a low FiO2 delivered to them. So the workaround for that is to attach the PEEP valve, which makes the exhalation port a one-way valve. The FiO2 the patient's getting is now good. The second issue with the BVM is that if there's any leak between the mask and the patient, then the patient is going to preferentially entrain air rather than oxygen from the bag, because to entrain oxygen from the bag, they've got to open these valves in the BVM. So we must ensure that this is sealed to the patient's face. The best way to do that is to use capnometry. And what we can do is just attach our usual circuit with the capnograph, the filter and the licorice stick to our face mask. Make sure our PEEP valve is on. Achieve a seal using a two-handed technique. And now when we look at the monitor, we should have a good capnograph waveform. If the waveform is either absent or dampened, then we have to assume that the seal is inadequate on the patient. So once again here, the non-rebreather wins as the fail-safe device. The BVM is only going to deliver a high FiO2. with a PEEP valve in place and a good seal with the face mask. Next is the ability to deliver PEEP. Clearly we can't deliver any pressure with a non-rebreather mask. So if we have a hypoxic patient who is got relatively low SATs or PaO2, despite the fact that they're getting high concentrations of oxygen, then they need PEEP in some form to aid with alveolar recruitment to try and improve their oxygenation. So we can't deliver PEEP with the non-rebreather. We have to use the bag valve mask or some other system like the NIV machine or the ventilator to deliver PEEP. So in the hypoxic patient, it's the BVM. Next up is ventilation. For some cases, we're going to decide to ventilate the patient through their apnea. Those are patients that are either hypoxic to begin with, or we think they're going to desaturate very quickly. So patients who've got a small functional residual capacity, like the obese patient, or the septic patient might be somebody else because of their oxygen demand who's going to desaturate rapidly. So if we need to ventilate the patient, we clearly can't do that with the non-rebreather mask. We're going to use the BVM or again a similar device like the ventilator. So the last point that I want to cover comparing these two devices is kit. First off, using the non-rebreather means that we need to have an extra oxygen source, because even when we use the non-rebreather, we still need to have the BVM as a rescue device. So if you have limited oxygen sources, the BVM is going to win. Secondly, we must have the high flow rotameter to be able to use the non-rebreather. If we're not able to deliver flush rate oxygen to the mask, then the BVM is going to win. So we must have the flush rate rotameter, otherwise we need to use the BVM in that situation. So to summarize, as you can see, there are pros and cons to both devices, and we need to choose the appropriate device depending on the patient in front of us. In a patient who's not hypoxic and has got relatively low risk of desaturation, then the non-rebreather mask gives a good FiO2, it's fail-safe, and therefore it's the preferred device for me in this situation. If the patient, however, is hypoxic or is going to desaturate rapidly, and either we need to deliver PEEP to the patient or we're going to ventilate them through their apneic period, then in that case we're going to use the BVM. But as a fail-safe device for the standard intubation, where we're not concerned about the patient's physiology, then the non-rebreather is the winner.